Good morning once again. My name is BC Roland from Post Service Department, Office of the Head of Service, Public Service Office. I welcome all members of the Association of Retired Heads of Service and Permanent Secretaries that are present on the call. Our esteemed retirees who joined early enough, good morning. And of course, my colleagues that are still in the service who have joined the session. I welcome everyone. This is our second session for January 2025. And our topic for today is managing high blood pressure and cholesterol. And we have with us a seasoned facilitator. But before we go into that, I would like to call on the Director of Post Service Department, Mrs. Durodola Olushola Bukwala, to declare the session open and to share a few words with us.
Good morning, distinguished participants on this call.
Good morning,
It is a pleasure to be with you this morning. The head of service and the permanent secretary are both unavoidably absent this morning. So I will be declaring this webinar open. I want to specially recognize all the retired heads of service and permanent secretaries on this call. I welcome each and every one of us. This morning, we are going to be looking at managing high blood pressure and cholesterol. As we all know, these are health conditions that are associated with old age. This morning, the experts in the house will be sharing valuable insights and practical tips on managing high blood pressure and cholesterol. And if there are latest researches and best practices and real-life examples, I'm sure she will share them with us this morning. I want to encourage each and every one of us to actively participate, take down notes that we can also refer to. I want to believe that at the end of this session, we will be able to manage our health conditions better and probably be informed on tips to prevent these health conditions. So on that note, once again, I welcome us. I declare this webinar open, and I wish us happy deliberation. Thank you very much.
Thank you, ma'am. Thank you very much. Okay. The director has given us a little bit of what we should expect from our facilitator. Her name is Dr. Laura Ukegheson Usoka, and she's a highly motivated medical doctor with a passion for providing excellent care to patients. She works as a medical officer in Lagos State Health Sector. She's passionate about maternal and child health, with the well-being of her patients being her utmost priority. She enjoys traveling and meeting new people. Dr. Laura graduated with Doctor of Medicine degree from Danilo Halitsky Liv National Medical University in Ukraine, and has a postgraduate diploma in addiction and mental health from the prestigious Humber College in Toronto, Canada. She's a diverse healthcare professional who enjoys working to make sure her patients get the best healthcare treatment possible. Okay, Dr. Lara, good morning.
Good
Welcome
morning,
to
ma'am.
webinar. Good morning. Yes, so over to you.
Okay, good morning, everybody. All protocols duly observed. Sorry, I have a little bit of cold, so it's affected my voice a little bit, but I'll try as much as possible to be audible enough so that everybody can hear me. Can everybody hear me?
Yes, we can.
Yes, we can. We can.
You are very audible.
Okay. All right. So our topic for today is managing high blood pressure and cholesterol. And we are going to be starting off using certain guideline outlines. So first of all, we are going to be talking about what exactly is blood pressure, how to take your blood pressure, what exactly is cholesterol, what are the risk factors, complications, prevention, and then management. These are the outlines we are going to use in the course of our discussions. Okay, so what exactly is blood pressure? Blood pressure simply means the force of blood against the artery walls as the blood circulates throughout the body. Your blood pressure normally rises throughout the day, but when it becomes on the high side, when it becomes continuously high for a long period of time, that's when it's a problem. We call that high blood pressure. We call it hypertension in medicine. Okay. Okay. So how do we measure the blood pressure? We measure blood pressure using two variables. That's when you go to measure your blood pressure, you see there's an upper limit and then there's one limit below it. So those two variables are known as the systolic, that's the upper limit that you see. And that simply represents the pressure in your blood vessel, in your arteries, when the heart is beating. That's the systolic blood pressure. And then the bottom one is the diastolic blood pressure, which simply means the pressure in your blood vessels when your heart is at rest between the beats. The heart will rest. That is just simply means the diastolic blood pressure. So when you measure your blood pressure, it's usually two values, the upper limit and the lower limit, right? So the upper limit, like I said, is the systolic blood pressure. And then the down limit is the diastolic blood pressure. So when the measurement reads about 120 systolic and 80 diastolic, you say is 120 over 80. Okay, next slide. Okay, so there are specific things that we need to know about high blood pressure. Number one, high blood pressure is not a communicable disease. That means you cannot get it from one person to another. It's not infectious. It affects both male and female. Most people that have hypertension are usually unaware that they have it, right? It's common in Nigeria. It's possible that you can have both hypertension and diabetes. Then it is the leading cause of death in most countries, or the leading cause, we can put it like this, is the leading cause of heart diseases, stroke, and kidney failure worldwide. High blood pressure is known as a silent killer. It can be controlled and it can be prevented. These are very important. I need you to take note of this slide. It is very, very important because some people think that you can get blood pressure from one person to another. You cannot. Okay, and it doesn't matter if you're a male or a female, it affects both genders. Okay, moving on. Okay, we have in medicine, we have categories that we can say if your blood pressure is normal, if it's pre-hypertension, if it's hypertension, like stages of classification of the readings of the blood pressure, basically. So when your blood pressure is below 120 and below 80, that means if your systolic blood pressure is below 120, for example, if it's 115, 117, that is below 120. Over 75, over 78, it is considered as normal. When your blood pressure is between 120 to 129 and below 80, it is considered as elevated blood pressure. Between the figures of 120 to 129 and the readings, the diastolic is below 80, it is considered as your blood pressure is elevated. Hypertension stage 1. When your blood pressure is between the ranges of 130 to 139, or that is the systolic blood pressure, is within 130 to 139, and the diastolic is within 80 to 89, is regarded as stage 1 hypertension. Stage 2 is from 140 or higher, or 90, the diastolic being 90 or higher, is regarded as stage 2 hypertension. Stage 3, or hypertensive crisis, is
Hello, doctor.
Sorry. Yes?
Please, I know you said you have a cold, but some people are like, they can't hear you very well. So please kindly take this particular slide again.
Okay, that's fine.
Thank you.
All right, can you all hear me now?
I believe so, but you can just go on and make it a bit louder. Thank you.
Okay. All right, that's fine. So I said that blood pressure can be categorized in three different stages. For example, if I say my blood pressure is normal, the systolic blood pressure that we talked about from the previous slide, when I talked about the pressure of blood in your arteries when the heart is beating, that is the systolic, right? It has to be below 120, and the diastolic, which is the pressure of the blood when your heart is at rest, right, should be below 80. So if I have 115, for example, 117 over 75, for example, it means that I have a normal blood pressure. Then when I say it's elevated, it means the readings are between 120 to 129, and the diastolic is below 80. So for example, I have 127 over 78. That means my blood pressure is elevated. Then I said hypertension stage 1 is when the readings for the systolic is between 130 to 139, and the diastolic is between 80 to 89. So if I have a reading of 135 over 85, for example, or 137 over 87, for example, it means that I have hypertension stage 1. Then for stage 2, the blood pressure has to be, the systolic blood pressure has to be between 140 or higher, and the diastolic has to be between 90 or higher. For example, if I have a blood pressure of a reading of 145 over 95, right? Or even 150 over 98, for example, I consider it as hypertension stage 2. Then when we say hypertensive crisis, is anything above 180 for the systolic blood pressure, and or anything when your diastolic blood pressure is above 120. That is when we have hypertensive crisis. Okay. All right. So high blood pressure is considered a silent killer. Why is that? Because many people that have high blood pressure, you might not even have any signs, you might not have any symptoms, you're just walking around not knowing what's going on. You don't even know that you have it, right? So that's why it's important to always check our blood pressures as regular as we can. For example, in Lagos State, we have about a population of 30 million people. But out of those 30 million people, 8,670,000 people are living with blood pressure. We have a prevalence rate of 30% only in Lagos State. And 70% of these people are even unaware that they have hypertension. Okay? Next slide, ma'am. No. Okay. So how do we measure our blood pressures at home? The first thing you need to do is to sit, right? You're preparing to measure your blood pressure at home. First of all, you have to avoid taking caffeine. People that like to take coffee, you have to avoid taking coffee. You have to prevent smoking or even doing any exercise 30 minutes before you measure your blood pressure. If you've eaten, you have to wait at least 30 minutes after the meal before you can measure your blood pressure. If you are taking blood pressure medications, you have to measure your blood pressure before you take them. Not immediately after taking your blood pressure meds, you're sitting down to check your blood pressure. No. Okay? So you have to empty your bladder before you check. You have to find a quiet space where you can sit comfortably without distractions. Then you're sitting down, your left hand, you can see on the diagram, the person is sitting comfortably well, and the hand is on top of a table. So that means you have to have a chair and a table where you can relax to take your blood pressure. Okay? And then when you're buying your blood pressure cuffs, please make sure you're buying the correct sized cuff for your hand. Okay? Okay, so when you sit down, you have to wait for at least 5 minutes before you can start checking your blood pressure. You can take 2 or 3 measurements 1 minute apart from each other twice daily for 7 days. You have to keep your body relaxed and in a good sitting position. You sit quietly with no distractions. That means you're not talking to anybody at this point when you want to take your blood pressure, okay? You're not watching the TV, you're not getting distracted whatsoever so that you can get an accurate reading. So you put the cuff in your hand. Most of these blood pressure machines are usually automatic. So once you place your hands, you put the cuff in, you can start the machine, right? And wait for it to finish reading and give you a result, okay? Okay, what is cholesterol? Cholesterol is a substance that helps your body in many ways. It is a building block of your cell membrane. So what does cholesterol do? It helps helps our body to create bile. It helps with hormones as well, and vitamin D. We need cholesterol, but when it's too much in our blood, that is when it becomes a problem. And it can cause risk of a heart disease. Okay, so naturally, our body in the liver produces the cholesterol that we need. And we can also get cholesterol from the food that we eat. Excess cholesterol is typically removed from our body, but this process sometimes cannot be enough, insufficient, leading to having a lot of cholesterol in our body and causing potential health problems. Let me note that cholesterol itself is not bad. It is vital for us to live. But when we have too much of it in the body, that is when it becomes harmful. Okay? So we have two types of cholesterol. We have the high density lipoproteins, which is considered as a good cholesterol for our body. And then we have the low density lipoproteins, which is considered as the bad cholesterol. Okay? The high density lipoproteins, right? They are mostly made from proteins. They are good cholesterol, like I said before. And then it takes extra cholesterol out of our bloodstream and transports it to the liver. Your liver will now break down this cholesterol and gets rid of it from the body. But, Ma, please, can you go to the next slide where I have an image? Wow, why?
The image is not showing.
Why? It's showing, and I have a perfect image too.
Oh, it says the image may have been corrupted. Oh, I wish I saw this earlier.
Oh, I have it on my end. Anyways, it was showing, it's an image describing the high density lipoproteins and the low density lipoproteins. That's the good and the bad cholesterol, right? It would have been nice for us to see because it will give them an idea of what I'm talking about. But
It's okay. You can send the picture, just the image alone. So when we send your slides to them, it would be included. You understand?
Okay, all right, that's
Mhm.
fine.
Yeah,
Okay.
thank you.
No problem, ma. So I said that the low density cholesterol or lipoproteins is known as the bad cholesterol. Why is that? They are very important. Remember, I said that cholesterol is important for our body as well. That is just when it's too much in the body that it becomes a problem, right? So I said that they become bad when you have too many of them. They are very important. Even the bad one, the low density lipoproteins, are important to your body. However, they become bad when you have too many of them circulating in the blood. They now combine with other substances and build like a wall, a plague. It's called the plague. It moves around the arteries. It accumulates around the walls of the arteries, causing it to be narrower, building up fat deposits, which is called the plague, that gets bigger over time, causing narrowing of those arteries or hardening of those arteries, thickening of the arteries by those building up of the plaques. And it raises your risk of heart attack, stroke, and other diseases. That's why this low density lipoproteins are considered as bad cholesterol, right? Okay, moving on. Okay, high cholesterol levels, too much of it is called hypercholesterolemia. And how do we know if our cholesterol levels are high or low or they're in between or whatever? This is done by you go to your doctor or your healthcare provider orders a test known as fasting lipid profile for you. When you do this fasting lipid profile, the doctor will be able to interpret the results to you. That means for you to do this test, you must be in a fasting state. You cannot do the test without being in a fasting state. The test to check your cholesterol level is known as fasting lipid profile, and it must be ordered by a doctor. Okay. Okay. What are the risk factors for high blood pressure and cholesterol? For hypertension, I said that increased blood pressure is called hypertension, and increased cholesterol in the body is called hypercholesterolemia. So there are different things that can cause risk factors for us to develop these diseases. Behavior. What do I mean by behavior? The kind of food that we eat, what we do, our personalities can affect hypertension, can be a risk factor for hypertension. Weight. When you're overweight, obesity is number one risk factor for so many heart diseases, even diabetes included. Obesity is a risk factor for a lot of heart conditions. So being overweight can cause hypertension. Physical inactivity, when you're not exercising, you're not moving around, you're just at a place, basically, is a risk factor for you to develop hypertension. Alcohol and tobacco use, too much of it can be a risk factor for hypertension. No. Same slide, ma. Okay, hypercholesterolemia, that is increase of cholesterol level. What can cause it? Behavior as well, your diet, your weight, your physical inactivity can expose you to having this risk factor to developing high cholesterol levels in your bloodstream. Another condition can be age, it's age related. Diabetes. Most people that have diabetes, most times come down with their cholesterol level being high. It can also be hereditary. That is, if somebody in the family, if there's a positive family history of somebody coming down with increased cholesterol levels, and you're not watching what you're eating, you're not exercising, you can have risk factor for that. Smoking and high blood pressure is a risk factor for developing hypercholesterolemia. Next slide, ma'am. Okay. For hypertension, more risk factors can be hereditary, which we call the trump card. Under this trump card, we have the age, the race or ethnicity. Black people are more prone to developing hypertension, diabetes. Approximately 60% of people who have diabetes also are living with high blood pressure. Family history, if there's a family history of hypertension in the family, there's a risk already for an individual of that same family to come down with hypertension. Okay. I've concluded with the risk factors for hypertension. So we are going to be talking about complications of high blood pressure and hypercholesterolemia.
Can you see the slides now?
Yes, I can.
Okay, all right.
All right. So, like we said before, hypertension exposes you to a lot of risk for heart diseases. It can cause stroke, kidney diseases, vision loss, memory loss, personality changes, a lot of things. But I'll go into details to explain how this is going to occur in the next slide. What it simply means is when there's high blood pressure, right, it causes the blood vessel for heart diseases, right? For heart failure, for example. How does complication of heart failure come out from having blood pressure? It can cause the heart to enlarge when the blood pressure is too high, it causes the heart to enlarge, and the heart being enlarged, it can cause decrease in the supply of blood flow to the body, which in turn can cause heart failure. Okay? For vision loss, it damages the vessels in your eyes. Blood pressure, increased blood pressure can damage the vessels in the eyes, which can lead to blindness. It can also damage the arteries in the heart and cause them to narrow and stiffen. That's causing those plaques that we talked about, which can lead to a heart attack. It can lead to kidney diseases because it damages the arteries in the kidneys, right? And interfere with the arteries in the kidneys, it interferes with their inability to filter blood through the body, then causing kidney problems. It can cause sexual dysfunction, erectile dysfunction in men, and in women, it causes low libido. Basically, the woman doesn't have that sexual urge as much as she used to. It can also cause stroke, right? How does this happen? It causes the blood vessels in the brain to burst or even clog more easily, so causing less blood to flow to the brain, which in turn can cause stroke. Okay, so for hypercholesterolemia, it can cause stroke, and the types of stroke that it can cause is ischemic stroke, which can occur when there's decreased blood supply to the brain. It can cause gallstones, erectile dysfunction, acute limb ischemia when there's not enough blood flowing to the limbs. It can cause limb ischemia, sudden cardiac death, and all of those things. Those are the complications that can arise from hypertension and hypercholesterolemia. Okay. So this slide is basically showing us all the things we've talked about. That means having high blood pressure can affect all your heart organs, basically. It can cause stroke when it affects the brain, heart failure or heart attack when it affects the heart, sexual dysfunction, kidney disease, vision loss. So you see, that's why they call it a silent killer, because you might not know, and all these dangers would have been going on in your body. Okay, next. Okay. This is also a slide showing us what the complications of hypercholesterolemia is: stroke, blindness, heart attack, kidney failure, clotting of those vessels. This was atherosclerosis. This was what I was trying to explain. If you see the yellow part in this vessel, no, the artery, no, the red one after the stroke, the next one, atherosclerosis. Yes. So you can see that yellow part in this place. It just simply means that those low density lipoproteins have clogged together. They have formed a barrier in this artery. So there will not be enough blood flow. They damage this artery, and the blood cannot go as it's supposed to flow. So this is just a diagram showing that. So how do we prevent hypertension and hypercholesterolemia? We can prevent all of these things by eating a healthy diet, maintaining a healthy weight, be physically active, do not smoke, limit alcohol intake, check your blood pressure regularly, which is very important, prevent and manage diabetes, Check your cholesterol levels often, okay? Next. Okay, so these are effective exercises, example of effective exercises that can be done. Exercise, please make it pleasant and enjoyable for yourself, not just to lose weight. Let it be that you're enjoying working out, okay? Please make it as enjoyable as you can. Okay, so now we are going to be talking about dietary approaches to stop hypertension. That is what the DISH diet is all about. Dietary approaches to stop hypertension. That's the DASH diet. Okay, what does this mean? This means it is a well-researched eating plan that can help us lower our blood pressure. This DASH diet emphasizes on eating nutrient-rich fruits like fruits, vegetables, whole grains, and lean proteins. Examples, you can make, for example, your fruits and vegetables. We can see on this drawing, you can see that the plate is divided into different portions and it's showing you how much quantity that you can eat. For the dairy, the nuts and seeds, it has to be like 2 to 3 portions. The meat, fish, chicken, 6 portions. Fruits and vegetables, fat and oil, 4 to 5 portions. Cereals, 7 to 8 portions. It's basically talking about the things that we need to eat, maintaining a healthy diet that would, in effect, help us to fight hypertension. Basically, this is what it's talking about. And then we also have to bear in mind that using this DASH diet, we have, for those that are hypertensive, we need to limit our salt intake. Salt is a no-no. We have to, I don't know how to overemphasize the limitation of salt intake. It is very, very important. Salt contains sodium. Sodium has the ability to increase our blood pressure. So limiting our salt intake is very, very important. And then we also have to limit our intake of added sugars into our food. We can limit our intake of sodas, candies, saturated fats, like fatty meat, full fat dairy, and oils like coconut and palm oil. We have to limit all those intakes. Please, it's very, very important. Okay, next slide.
Yeah, the next slide is an image too, but it's not displaying.
I wonder
So
why.
this is where we'll go to.
I wonder why. The next slide, when you send it to them, they will see it's just a food pyramid where I showed all the important foods, things to avoid, things to eat. That image is a food pyramid. So it's very, very important. When they get the slides, they will be able to see it.
Yes.
Okay, yes. The next slide. So we've talked about this before, but I need to also emphasize on it more. Measuring your blood pressure at home. Remember, I said you have to avoid taking caffeine, smoking, eating 30 minutes before you can measure your blood pressure. People that are hypertensive, you don't have to take your hypertensive medication before you measure your blood pressure, okay? You have to find a comfortable sitting arrangement. Sit down, rest your hand on the table. Your feet must be on the floor, right? Wait at least 5 minutes after sitting, then you can start measuring your blood pressure. This diagram, I got it from the American Heart Foundation. So it's very important that we look at this diagram. It's the same things that we've talked about, but this is a clearer diagram highlighting the things that needs to be done. Okay. And then it's also it is also important that I emphasize that if you're uncomfortable and if you're stressed or if you're in pain, please do not measure your blood pressure immediately. You have to sit quietly for at least 5 minutes before taking a reading. Do not measure your blood pressure when you're feeling uncomfortable, when you're stressed, when you're in pain. Please wait 5 minutes. Feel better, and then you can measure. All right? Okay. Next slide. Okay. You know the things that we've talked about the preventive ways, what we can do to prevent hypertension and cholesterol. It is very, very important that we carry out our regular health checks. Please go to the hospital as regular as possible. Okay. Preventive care is better than curative care. That means you're preventing this thing from happening, other than when you already have it and you're going to the hospital for checkups. Okay. You have to do your comprehensive medical screening at least once in 2 years for every adult that is more than 45 years. What does this include? It includes complete blood count, that is the full blood count, your kidney function test, which is your EUCR, liver function test, occult fecal blood, tumor markers. The tumor markers are the alpha fetoprotein, CA125, PSA for men, to check for prostate cancer. It is very, very important. We can also do chest x-rays, abdominal pelvic ultrasound. Need be, the doctors will recommend the tests that are good for you. But try to go to the hospital to do your comprehensive medical screening at least once in 2 years. Please, it is very, very important. Okay. Management. Please, every one of us should acquire a home blood pressure monitor and keep a blood pressure log by taking readings at least twice a day. One in the morning upon waking up and one at night before you go to bed. It is very important, even more important for those that are already on antihypertensives. It is very important that you keep your blood pressure log in a book so that the doctors, when you go to visit your doctors, they can understand how well the medications you're taking, how well it's working for you. If the medications needs to be adjusted or not. With having these logs, the doctors will be able to understand how best to help you. We also need to make lifestyle changes, like eating healthy, following that DASH eating plan that we talked about. DASH simply means dietary approaches to stop hypertension, the eating plan that I talked to you about. The medications will be given to you when you go to the hospital and the doctors realize that you're hypertensive. They'll give you antihypertensive medications. And if you have cholesterol, after doing your fasting lipid profile, when the doctors look at the values and it's not looking good, they will give you cholesterol lowering medications to help you. Not to the pharmacy, to the doctors. You have to do all of these things in the hospital, not going to the pharmacy. Please, it is very, very important that you go to your doctors. And even when you're placed on these medications, like I said before, keeping a log of your readings is very, very important, so that the doctor can always follow up and see how well these medications are working for you, if they need to be adjusted, if they need to be brought down. Please note, most of the time, hypertensive medications are for life. And you cannot stop taking the medications by yourself without a doctor recommending that. You're doing yourself more harm than good. Because I've seen a lot of patients, I've seen a lot of patients that say, oh, doctor, and this drug was not working for me, so I stopped using it. Or, doctor, I've noticed that my blood pressure has been, I've been checking, it has always been 120, so I don't see the need to use this medication. Please, if you don't learn anything today, learn that you cannot stop taking your blood pressure medications without a doctor's notice. It is very, very important. That is why I'm emphasizing on keeping a log of your readings, your daily readings, morning and evening. So if you feel that your blood pressure has been quite controlled for a long period of time and you're going to your doctor, the doctor will not abruptly stop you from taking this medication. They can first of all start by lowering the dose that you take. So please, it is very important that we don't make these decisions by ourselves. Schedule your regular follow-up appointments with your healthcare provider. That is your doctor. Always visit the hospital. We will know when anything else needs to be done, and we will do that. Okay? Enhance your physical activity. Please exercise, even if it means walking your estate 30 minutes, walking around your estate, walking to buy the groceries you need. Please and please and please. Physical activity, it is very, very important, because physical inactivity predisposes you to being overweight or obese, which is a risk factor for a lot of heart conditions, not only hypertension. Please. And then I said before, to limit our salt consumption. Like I said, salt contains sodium, which has the ability to cross the blood-brain barrier and increase our blood pressure. So limit your salt intake. It is very, very important. Okay. Next, something else that I want to say is, people say that, oh, I'm overthinking. And since I've been thinking, that's why, okay, maybe I have financial struggles and I'm thinking of how to pay off my debt, I'm thinking of my children. And is that overthinking that has caused blood pressure for me? No, I will say that overthinking causes stress on you, mental stress, physical stress, which in turn causes blood pressure, not the overthinking. Is the stress that in turn causes increase in your blood pressure. Okay. And then I wanted to say the next slide. The World Hypertension Day is on May 17th. The whole world recognizes hypertension on that day, May 17th of every year. Please, always check your blood pressure. It is very important. Remember that we said hypertension is the silent killer, because most people that have hypertension might not have signs and symptoms. They might not even be aware that they have it, and boom, it happens. The person already has complications and we are not able to resuscitate the person. I've had a case 2 months ago in the hospital. A lady woke up, she did her regular activity, they did their regular prayers in the morning. She went out to see a friend, and it was on her birthday. It was on her birthday. She actually went to visit her friend. Unfortunately, she fell. She's a known hypertensive who has not been taking her drugs. She didn't complain of nothing. She was healthy. However, during the course of visitation to her friend, she fell. And before they could rush her to the hospital, she was gone. They brought her in dead. We could not even, her blood pressure was unrecordable when we tried. We tried to resuscitate her, but unfortunately, she was gone. So that's why it's important for us to check our blood pressures as often as we can. It is very, very important. Thank you so much for your attention. I hope you learned one or two, and I'll be looking forward to questions.
All right, Doctor, thank you very much for your presentation. It was very insightful and educative. Thank you so very much. Okay. I'll just take a very short recap of her presentation, although she, did so much justice to the topic. So, once again, the topic is managing high blood pressure and cholesterol. And she defined hypertension, also known as high blood pressure. And she said it's not contagious. It affects both men and women. And many people are not aware that they have it. It's a silent killer and it's very common in Nigeria. And it is the leading cause of heart diseases and sudden death. She also talked about how to take the measurement, when you want to take your blood pressure. So you have to avoid coffee. You have to avoid smoking before you take it. You have to, if you took a meal, you have to wait for at least 30 minutes before you take your measurement. And you have to empty your bladder, be in a quiet place, and it's best taken twice daily for 7 days so that you know how the whether it's going so low or so high. So it's better to take the measurement twice daily. Then she said there are two types. We have the high density lipoproteins, which are the good cholesterol. No, sorry, she talked about cholesterol, yes. So under cholesterol, there are two types. The high density, which is the good cholesterol, and the low density lipoproteins, which is the bad cholesterol. And it's for you to take the test, it has to be recommended by a doctor. And you can't just, take it. And whenever it is that you're even advised to take the test, you have to be in a fasting mode. Yes, and she advised that we have to manage because it's a life-threatening, disease. So you can't, the medication, it's life, you take it for life. You can't just stop it abruptly. You have to always visit your doctor or your physician. And she talked about how to manage it. We have to change our lifestyle, healthy diet. You have to take your exercising religiously. You have to do at least 30 minutes of moderate exercise. You have to watch your weight, limit alcohol, and if possible, no, you just have to stop smoking because, it affects the heart. Then you have to monitor your stress. You shouldn't be too stressed, so that it won't affect you shouldn't cause stroke. Like she said, stroke doesn't just happen. It's caused by some underlying factors. Then she advised to limit salt consumption. We have to stay away from salt. We have to limit it. Then you should have a comprehensive medical screening. It's very important. At least once in 2 years, once you are over 45 years and above. And I know majority of us on this call are over 40. I know that we are over 45 years. So it's advisable we go for a comprehensive medical screening. Yes. So now we can go into our question and answer session. I'll advise if you have any questions, please raise your hand or chat or send your questions in the chat box. But please, before we do that, I'd like to acknowledge the presence of Mrs. Florence Oguntuashe, our retired permanent secretary and a one-time honorable commissioner in the Ministry of Establishment, Training and Pensions, before the name was changed to Establishments and Training. Good morning, Ma. Can you please unmute yourself, Ma, and kindly say a few words to us, Ma? Good morning, Ma.
Good morning. Can you hear me?
Yes, we can, Ma.
Okay.
Welcome.
Happy New Year to everybody.
Happy New Year, Ma. Compliments of the citizen.
Yes, I was following the lecture and I want to say thank you to the lecturer for a very well-researched paper. Now, I want to say that what I have taken from the lecture is the fact that you don't stop your medication abruptly. A little while ago, I had a manager that was managing my store and was giving me a lot of stress. I have a moderate hypertension, as it were. And when this lady came on board, it really went high. And at a stage, I decided that I was going to let her go. That was the only way. Hold on. That was the only way I could reduce whatever, because I was taking all kinds of medications. I would take tests. They would say nothing is wrong with me, but my blood pressure was very high. So I let her go. When I let her go, my blood pressure dropped almost below normal. And I felt good that about time to stop all the medications I was taking. But as the doctor advised, I went to see my doctor, and the doctor said the best she could do was to reduce the dosages to the minimum, but that I could not stop it outrightly. So I think that point has been well emphasized, and I want everybody to take it seriously. Hypertension is not a cause that you will say is not my portion. By the virtue of the fact that we are Blacks, we have been told that we are prone to it. So everybody should take their health more seriously. Thank you very much.
Thank you very much, ma'am. We appreciate your contribution. Thank you, ma'am. Okay. Questions, please. You can please raise your hand or send the question in the chat box. Okay, in the chat box now, someone said, I believe gardening or home farming should be added to the exercises. Yes, that's very true. It's a form of relaxation. Gardening is a form of relaxation. Yes, thank you. Madam Yetunde Simpson, thank you. Someone said, thank you, doctor. This is a good presentation. Yes. Yes, we'll send the clip to the retirees platform. Yes, we will do that. Okay. No questions for our facilitator. Dr. Amos, I've really done a very good job then. Hello, doctor, are you still on? Oh, okay, I think she has. Doctor, can you unmute yourself, please?
Yes, I am. I am.
Okay, okay. Although, okay, some questions are coming in now. Could there be adverse health conditions from these lifelong medications?
Of course.
Did you get that? I think
Yes.
talking about side effects from
Yes.
the.
Yes. All medications have side effects. Okay. Like the amlodipine, it causes headaches and all of those things. But that's why you have to be in constant contact with your doctors. If you notice any changes when you start using these medications, you need to go back to your doctor and say, hey, this is what I've noticed, and we can change it to another one. Of course, there is no drug without the side effects. However, when the side effects happen, for example, lisinopril causes dry cough, right? So even if you're taking cough syrup and you're on lisinopril and you keep coughing, except that medication is changed, the cough is going to continue no matter what you take. So that's why you have to always be in contact with your doctors. And if you notice anything, don't be too shy to let us know. We know the best things to do for you as long as you're taking your medication and you have side effects to this medication.
All right. Another question. Can sugar intake cause BP complications? And can the intake of blood pressure drugs cause eye problems? So there are two questions in one.
Okay. So you remember when I talked about the DASH diet, I talked about us
Yes.
limiting our sugar intake as well, because all of these things are risk factors for us to gain weight, and which in turn leads to hypertension. So sugar intake, a lot of it can cause or can be a risk factor to developing hypertension. Okay. And then taking blood pressure medications, if it can cause eye problems. Hypertension itself, when we talked about the complication, we talked about vision loss, right? And even cholesterol level. We talked about blindness. So it's a complication of hypertension and cholesterol at the same time. So yes, it can, but it's not the medications that will cause the blindness. It's a complication
okay.
from the hypertension itself.
Okay. What is white coat hypertension and how can it be managed?
Okay, white coat hypertension simply means hypertension. People that are not hypertensive, people have the fear of hospitals, right? So some people, when they go to hospitals, they are usually very scared about seeing a doctor, seeing a nurse, just the hospital setting per se. Some people go into the hospital and their blood pressure will just go beyond the usual. You know, I talked about normal blood pressure being less than 120, less than 80. That's normal. And when it's elevated, right, between 120, 80 is elevated. So basically, when you don't have blood pressure, you go to the hospital, the fear of the hospital, it makes your blood pressure to rise a little bit. So how can you prevent this or how can you manage it? When you get to the hospital, You need to sit down a while, not just coming to the hospital. You're just getting there. The next thing, you're going to the nursing station to check your blood pressure. So when you get to the hospital, you need to take some time to sit down, relax for like 15 minutes so that your blood pressure and your body calms down before you go check your blood pressure.
Okay. Another question, which seems funny to me. How can we manage how can we manage high cholesterol using diets and fruits, considering the cost of vegetables and fruits? So are there alternatives without taking vegetables and fruits? Doctor.
No. No,
Okay.
to be honest, no.
Okay. All right. Can diet be used to minimize the effect of drugs?
Everything goes hand in hand. I would say everything goes together. So your diet, your drugs, your exercising, right? That's why we talked about all of these things. It cannot be done one without the other. It has to be a combination of all of these things. You cannot use diet to minimize the effect of the drugs. You also have to watch what you eat, but you still have to take your drugs, basically.
Okay. Can the take of ramipril, I think that's the pronunciation, can the intake of ramipril cause loss of weight after overcoming the coughing stage? Okay, this doesn't have to do with our topic, but can you please answer the question if you do know? Can the intake of ramipril cause loss of weight?
Okay, so the side effect of ramipril is cough. So I don't know that's one of the side effects of ramipril. I don't understand what the person is saying, if it can cause loss of weight after overcoming. I don't understand, because one of the side effects of ramipril is cough. So I think you need to go to your doctor and find out if you've overcome the coughing stage. And I really do not understand the question, to be honest.
Okay, Madam Adekemi Adesanya, if you don't mind, maybe you can expatiate on your question so that the doctor can, take it up. Okay, what is the relativity of high blood pressure with insomnia, which is lack of sleep?
Yeah. Okay. Insomnia is a whole different topic altogether. But, people that have high blood pressure, if your pressure is very high, first off, you have headaches, right? You have some of them have this terrible headaches. And when you have headaches, you will not be able to sleep because you're not settled, right? So, I think high blood pressure can be linked a little bit to insomnia, but not completely.
Okay. Please, can you tell us the difference between stroke at the left and the right side? And is there any solution?
Okay. Okay. Anyways, we are not talking about stroke, right? But the difference between stroke on the left, it depends on the part of the brain that is affected. The part of the brain that is affected will let us know if you have the left-sided stroke or the right-sided hemiparesis. It depends on the type or the part of the brain that is affected. Is there any solution for stroke? Yes. There's preventive measures that can be done for us not to have stroke. like I said before. One, checking your blood pressure often, because high blood pressure is a risk factor for development of stroke. So checking your blood pressure often, those that are hypertensive, always taking your medication. Always. Do not stop your medication abruptly. All the lifestyle changes that we've talked about, like limiting salt intake, exercising, all of those things can serve as a solution to preventing stroke from occurring.
Okay, this is a nice question. Why is a very slim person liable to high cholesterol? And what is your health advice?
My health advice, you know, I said that cholesterol, there can be family history of cholesterol. So if there's a family history, it's genetics. There's nothing you and I can do about it. It's genetics.
So even if the person is slim?
Yeah, and there's family history, right? So even if the person is slim, your cholesterol level, you do your fasting lipid profile, it comes out that the cholesterol level is high, right? What can we do? Just if there's family history, all we need to do to prevent it from occurring is adhering to all the preventive measures we talked about. Being slim is not a guarantee that you cannot have high cholesterol level. No, it's not.
Okay, this is a comment, and the person says, Olaiton Utulano, I don't agree that salt should not be taken. It is sodium chloride that is, oh, it is sodium chloride, and people should be advised to take natural salts like Celtic sea salt, Himalayan pink salt, and sea salt. And she says that these salts are beneficial to the body as they contain potassium and magnesium. I don't think she said we should stop. Okay, doctor, you can please, what's your take on that?
I said to limit
To
our
limit.
salt
Yeah.
intake
Yeah.
because salt contains sodium chloride, which has the ability to pass through the blood-brain barrier and increase our blood pressure. So that's why even in the hospital, when you go to the hospital and you're very weak and we measure your blood pressure is high on the high side, we cannot give you normal saline. Normal saline is just simply salt and water, basically, right? If I'm to explain it in a plain man's language, it's salt and water. Why we can't give you normal saline at that point is because when we give you the normal saline, it contains sodium, which can in turn cause more increase in your blood pressure. I didn't say to take off salt completely. I said to limit the intake of salt because it contains sodium, which can cause adverse effects on your blood pressure.
Okay. When is the best time to take the medications, morning or evening?
Morning. Morning.
Oh,
Why
morning.
did I say morning? Most of these blood pressure medications do not require food for you to take them. They are not food-dependent medications. So taking them first thing in the morning, after your morning prayers, is the best advice. That way you don't forget, because some people get busy during the day. I say, oh, I take my medications in the evening. I go to work, I come back, I'm very tired. Oh, let me rest a bit. I sleep off. And I don't get to take these medications. But if you make it as a rule that you're taking your medications first thing in the morning, it helps you. And most of the time, these BP medications have the ability to control your blood pressure within a 24-hour period, right? So when you take it in the morning, it's till the next morning. You take it, you're good to go for the day till the next day. So I advise to take your medications first thing in the morning.
Okay, all right. I'm sorry, someone raised his or her hand earlier. I think I missed that. So please, if you can, kindly raise your hand or put your question in the chat box. Okay, someone asked, if we must take eggs, what form should we take it? Fried, boiled, or scrambled?
Any form you
Okay, this
enjoy.
is the nutrition. Okay, any form. All right. What is the risk in experiencing pains in the shoulders, and what is the signal?
Pain in what part of the
In the
shoulder?
shoulders, the two shoulders.
Okay. Risk in is the person hypertensive?
I'm sorry, I don't know if it's Mr. or Mrs. Taiwo Kolawole. The doctor is asking if you're hypertensive, so you can, mute yourself so that you can talk with her. Mr. Adekunle Nuga, are there some supplements or multivitamins that can help to mitigate this challenge? Okay, are there more supplements or multivitamins that can be taken? Doctor?
I don't have any idea about multivitamins or supplements that you can take to stop blood pressure. I only know about your BP meds.
Oh, okay. Mr. Taiwo Kalawale said he is. I think the person is.
Okay, the person is hypertensive. If you begin to experience pain in your left shoulder, please, you need to see a doctor. You need to see a cardiologist ASAP. It's a warning sign. You need to see a cardiologist. When last did you do an ECG? Maybe you need to do one. So we'll see what exactly is going on there. Okay. But you need an urgent cardiologist review.
Okay. Another person says he knows someone that is diabetic, and while on bed, he started talking incoherently and had a stroke. And the doctor said it's because of the diabetes. So can diabetes cause stroke?
Of course.
Hello, doctor.
Of course.
Oh, okay.
Diabetes can as well. Yes. I said yes. Diabetes can. It can.
All right. Okay, Mr. Taiwo Kolawale. Okay, I'll just unmute you now. Please unmute yourself, Mr. Kolawale.
Good morning, doctor.
Good morning, sir.
Oh, sorry. This is.
Good morning, ma. I'm a Mrs.
Sorry, ma. Sorry, ma.
Sorry.
Yes, and well done. Concerning my aunt that is experiencing it, she has been to the doctor, and she has been put on exercises for more than even 8 years, and it's not subsiding. It will go today and come back tomorrow, and she takes her medication very, very well. But she's still experiencing it that she could not even raise the two hands up. So that's why I asked that question.
Oh, I'm so sorry to hear this. However, oh, sorry. I'm so sorry to hear this, ma. However, what did the doctors do? What did they say was the problem? And how long has she been doing physiotherapy? And I would want
It's over
to know.
8 years.
Okay, so
It's over 8 years.
What did they say is the problem?
Now, in the last, towards the end of last year, surgery was recommended for her. And she's about, I think, 67, which she's not cooperating with the family to do.
Okay. Did she have a fall? Did something prior to her experiencing this pain?
No, the pains just cropped up after her retirement as a head of school.
Was she a teacher?
Yeah, she
Okay.
retired as a head of school.
Okay, now I can understand what the situation is. But anyways, she needs to go ahead with what the doctors have recommended for her, since they already know what the situation is and they've given a plan. She needs to go ahead with what the doctors are saying, because for them to recommend surgery, there must have been something they saw. That's why they recommended surgery. And since she's been doing physiotherapy over 8 years and the pains are not subsiding, I feel it's better you advise her to go ahead with the plan that the doctors have given to her.
Okay, ma. Thank you so much.
You're welcome.
All right, thank you. The time is 12 noon. I think we've gone 30 minutes past our time, but I appreciate everyone for their attendance today. Thank you very much. And the doctor, our facilitator, thank you so very much. But before you go, Madam Temitope Oguntayo, can you please unmute yourself, please? So you would appreciate our facilitator on behalf of everyone, if you don't mind. Madam Temitope Oguntayo. Okay, maybe she's not. Okay, what about Madam Tutu Adebowale? Can you please unmute yourself and appreciate our facilitator? I don't know if you can hear me. Oh, okay. I'll call on another person. Madam Modupe Ola Ibrahim. Oh, okay. Okay, the director would like to say a few words before we end. Mrs. Jordan, please, can you unmute yourself, ma'am? All right.
Thank you very much. I want to say a very big thank you to every participant on this call. It has been very engaging. And I want to say a very big thank you to our facilitator as well. It's a very comprehensive presentation. And I know that some of us must have taken notes. I want to encourage us to go back to those notes and ensure that we imbibe all the advice that we've been given. I also want to encourage us to refer back to the YouTube channel. We are live on YouTube now, and I'm going to post the link on the chat. Let's visit the YouTube channel. Let's subscribe, and let's share with our friends. We need to be on top of the management of our health, especially as it relates to hypertension and high cholesterol, which we have learned today is the leading cause of death. And even with all the attendant complications that can follow, like stroke, like loss of vision, and more. So I think it's something we need to take very seriously. I want to once again thank all of us for joining this call. I want to especially greet Mrs. Ogunsuwashi, retired PS, former Honorable Commissioner in the state, and all other members of the Alausa of this call. Thank you for always returning, and God bless you all. I think we need one of the participants to appreciate our facilitator today. Can someone please signify so that we can do that? Mrs. Roland, can you please unmute everybody? Change the setting, unmute everyone so that someone can freely unmute and appreciate our facilitator. Thank you, Mrs. Roland. Have you done that? Are you with us, Mrs. Roland? I'm not sure she's there. I'm not sure. She's not responding. So let me just invite Mr. Nuga to appreciate the facilitator. Mr. Nuga, you can unmute.
Hello.
Yes. Go ahead.
Good afternoon, please. On behalf of my fellow participants on this call, I express our appreciation to our permanent secretary, our HOS, Mrs. Drodola, the director of the PSD, Mrs. Roland, and other staff members. And above all, we are giving our thanks and prayer to our dear doctor that has given us a life-sustaining, life-enhancing, comprehensive lecture on how to maintain our health and prevent these deadly health challenges. That is high blood pressure, high blood sugar, diabetes. Thank you so much. God bless you. You're going to grow and increase in the wisdom and knowledge of the Most High in Jesus' name. And I believe that by God's grace, when next we need your services and the department contact you, you'll be readily available to come and share your wealth of knowledge and experience with us. Thank you so much. We appreciate you. God bless you.
Thank you so much. Please, once again, let's look at the chat. The YouTube link is there, and you can always go back and then listen to the presentation once again. And then all the other presentations we have done before, I mean all the other webinars we have done earlier, you can always pick anyone that you desire to listen to once again and do that. So we've changed the setting. Everybody can unmute now. So as we usually do, let's put on our videos. Let's see each other's faces. Let us exchange pleasantries. Let's do that. Okay. I'm seeing faces now that I've not seen in a while. Mrs. Kuteyi, thank you for joining. It's a pleasure seeing your face. You can talk, ma. Ẹ má kàn dúró o. Mo fẹ́ gbóhùn yín o.
Hello, everybody. Good to see you all.
I can
Mrs.
see
Yola,
my
keep on
senior
making
in
work.
school, Mrs. Shola Cole. How are you? And Mrs. M.M. Kuka, Mama Kuka.
Bless
Good to see you.
Thank you very much.
Adúpẹ́.
Then say
Thank you. I can cite you. Thank you.
Yes, good to see you.
Nice
And then Mr. Bangoshe, ẹ ti ń warm up fún retirement àbí? Good to see you. You can unmute. You can talk.
Ẹ ṣé o. Ẹ kú iṣẹ́ o.
Ẹ ṣé. Ẹ ṣé o.
I can say Secretariat.
hello, everybody.
Let's feel free to talk to each
Hello,
other.
everybody. Mrs. Koka, ẹ kú ọjọ́
Miss
mẹ́ta.
Adesanya, mo kí yín o. Ẹ kú ọjọ́ mẹ́ta.
Thank you so much.
Sẹ̀mí Sotúlànà.
Ṣé ẹ̀ gbóhùn Mr. Daudu ni mo gbọ́ yẹn?
Èmi mò ń sọ̀rọ̀ mo ń kí yín.
Ẹ káàsán sà.
Ẹ káàsán ẹ kú iṣẹ́ o.
Mi tètè mọ̀ pé wà on the call. Ẹ káàsán sà.
Ẹ káàsán.
How are you, sir?
I'm fine. Ẹ kú iṣẹ́.
We thank God.
Ọlọ́run máa bá yín ṣe o.
Àmì sà.
Emi, you are joined the retirees. Welcome to the club.
Àwọn àgbà rìtàrí rẹ̀. Mr. Agoro Omut.
Kudos to Director Post Service Department, Mrs. Durodola. Well done, well done,
Thank you.
well done. You have really tried in that department for all retirees. And we are passing down the knowledge onto others that are not even on this platform. Thank you so much.
Okay.
God bless you.
Thank you, ma. And you too, ma.
Mrs. Cole.
Mrs. Cole, wọ́n ń pè yín ẹ on mute. Ẹ on mute now. Mr. Daudu ń pè yín.
Mrs. Cole. Mrs. Cole ò gbọ́.
Mrs. Durodola, ẹ káàsán o, dé ń bọ́ sọ̀rọ̀ o.
Ẹ káàsán sà.
Ẹ káàsán ma.
Mr. Onde.
Ẹ ṣe àdúpẹ́ o.
Ẹ jẹ́ ká rójú yín. Ẹ kàn ń gbé design pillow fún wa.
Front camera ní issue ni. Front camera phone mi ní issue ni. Front camera ní issue ni.
All right.
Ẹ ṣe gan àdúpẹ́ o.
Olúwa ṣeun sà.
Bàbá akẹ́ dọ́tọ̀ o.
In
fact, me personally, I'm really getting on it. Seriously. So that YouTube channel, me link here to YouTube.
Okay, let me send it again. So it will be the last message on the chat.
Okay.
So I've sent it now.
Okay. Yes.
Auntie Shola, unmute. Auntie, unmute everybody now. Unmute any unmute ara yín. Oh yeah, go and click on the unmute. You'll be able to speak. Everybody can speak. Okay. So I think we have come to the end of the webinar for today. Once again, I want to appreciate everyone on this call. We are going to be having another session the next 2 weeks. We'll communicate the topic as usual. So thank you for joining and God bless you. Enjoy your day. Bye.
Bye. Thank you.
Bye.
Bless you all.
Three in one. 3 in 1 is one. That one is 1,000.
What happened to your
I don't know.
network?
It just went off. I didn't even think it's network because it just started converting. So
No, once
the time.
once it has X, you are out, and it says you are not coming back. Start converting, and it shows that you are done.
But how come I was still showing on the?
I can see music.
No, you were talking. Your video was.
I logged in
Oh, okay.
because I couldn't unmute, so I had to take the host to take over the host. I know if I log in on another device, I will be the host, so I will be able to control the system. That's what I did.
As I clicked on mute, it just went off, and I was wondering, what happened? But right now. One six in 6 1 8 6 and 1 8. Bolanda 1 6. Bolanda 1 6. Take a picture. Okay, everyone, just switch off Bolanda. Amazing day. Happy. Take for me time. Okay, I go mention. Talking more data, like. I will follow.